At least 146 people have died of malaria in the Western Democratic Republic of Congo since the beginning of the year. The surge comes as the country battles an Ebola outbreak that has killed more than 900 people in northeastern DRC since May. SABC News correspondent Ocamringa joins us now from Kinshasa. Well, Chris, good evening. Thank you so much for that. Can you tell us what the latest statistics are coming out of the health department in the DRC?
Yeah, so health authorities in the western province of Kwilu have expressed concern about the high number of deaths of malaria in that region. They're saying most of these cases had people presenting symptoms similar to Ebola, and it's a remote area. They do not have a national laboratory over there. So they had to send samples to the capital, Kinshasa, and tests were carried out, and all the samples tested positive for malaria. They're saying this is a severe form of malaria that has symptoms similar to Ebola. People were complaining of abdominal pain, fever, and they were vomiting. And that, created a scare in that part of the DRC. But malaria is one of the leading causes of illness and death in the DRC. In 2024, there were about 67,000 people who died. And the DRC government is working with international partners. They have come up with a national strategic malaria plan that's supposed to go for 4 years, from 2024 until 2028, to try and stop this disease from killing people. Most of the people who have been dying are children under 5. And that is something that is of great concern to the government and the development partners who have been supporting the government to stop the diseases like malaria, cholera, and measles that have been killing children.
Yeah.
Oliver?
Is there an overlap in the Ebola outbreak, geographically that is, in the Ebola outbreak and the recently reported malaria outbreak?
Yeah, so the Ebola outbreak has also continued spreading in the northeast of the DRC. We're told now it has spread to 5 provinces in the east and the northeastern part of the country, but the epicenter is in Ituri province, where there's an active conflict going on over there. And so health workers cannot reach all the patients around the area because it's not safe. That is one of the big challenges they're facing. The other is the mistrust of some community members who do not believe that Ebola exists. They're saying this is a hoax, so they're not taking their people to healthcare facilities to get isolated and get treatment. And the key thing that health workers are saying is that people who receive treatment early can survive this deadly disease. But some of the people do not believe it, and there's always been, clashes with some of the health workers who are trying to move around the areas in Ituri to try and find suspected cases. So health workers are working with international partners like the World Health Organization, Africa Centers for Disease Control and Prevention. There's a lot of money that has been mobilized, but the disease has been spreading fast, really fast. We're told there are 999 people who have died. Now, the DRC had its worst Ebola outbreak in 2018. That outbreak went on for 2 years, and there were about 2,300 people who died. But this latest outbreak, which is caused by a rare strain known as Bundibujo, has only gone on for 2 months, and we are told that there are now 1,000 people who have died. So that has caused a lot of concern in the DRC and the neighboring countries, who are now stepping up surveillance to stop this disease from crossing to their countries. Yeah. Oliver?
Hospital beds, they must be under severe strain at the moment in terms of the numbers. We know that very specific remote hospital and sites have been set up to deal with Ebola, but that, of course, due to the strike, have not always been effective. What do hospitals' admissions look like at this moment, Chris?
Well, a number of hospitals, like in the provincial capital, Bunia, are overwhelmed by the number of patients who have been taken to get treatment. There are other areas like Mungwalu, Rwampara that have also very many patients who are getting treatment right now, but the area is quite large, and there are some people who do not want to take their sick to these Ebola treatment centers, and so that is one big challenge that they're facing. There has been a lot invested in information campaigns. The government is working with local celebrities in that area, religious leaders, and other musicians to spread the word around about the existence of this disease and what they need to do to stop it. They're urging the people to work very closely with health workers, report any suspected cases, but there's still some challenges in some of those areas, especially areas that have a lot of rebels like Mungwalu. That is an area that is rich in gold, and there are lots of rebels in that area. And so that is one of the challenges that the DRC government is working with other experts like World Health Organization to try and overcome, to contain this disease.
Yeah,
Oliver?
Chris, thank you so much for that. Really do appreciate it. Chris Ocamringa coming to us live there from Kinshasa on the latest in the DRC pertaining to the malaria and Ebola outbreak that is persisting.